Chapter 30, Nursing Care of Patients with Upper. Okay, so our learning outcomes. We want to explain the pathophysiologies of disorders of the upper respiratory tract, describe etiology, signs and symptoms of disorders of the upper respiratory tract, describe current therapeutic measures for disorders of the upper respiratory tract. We want to plan nursing care for the patient with an upper respiratory disorder, discuss how you will know if your care has been effective, and identify the special needs of the patient who has undergone a laryngectomy. So epistaxis, more commonly known as a nosebleed. The causes can be dry, cracked mucous membranes, trauma, hypertension, hemophilia, and some medications can also cause nosebleeds. Therapeutic interventions are positioning, direct pressure, ice. Ice helps because it constricts the vessels. Nasal packing, a nasal balloon catheter, vasoconstrictive agents, and electrocautery. Also, they have silver nitrate that they put in there to stop them. Oh, but it burns horribly. The problem is back in the day, we used to put pressure and then lean our head back, and that was causing patients to aspirate and blood to coagulate in our throats and cause a more higher case for aspiration. So they don't recommend leaning back or laying down flat any longer. Just make sure that you're applying pressure and trying to stop the bleeding. Nasal polyps are usually benign. They occur more often with allergies, and the therapeutic interventions is to control the allergies. Surgery may be recommended if they are too big and they're blocking airways. And we want to avoid any aspirin post-op because that could lead to bleeding. Our deviated septum often happens from having a broken nose. It blocks the airway. It causes snoring, stuffy nose, blocked sinus drainages, and headaches. Our therapeutic interventions for a deviated septum is to monitor vital signs and bleeding, report excessive swallowing, monitor dressings, teach post-op care, and avoid activities that increase pressure and avoid aspirin. So sinusitis, well, everybody's had a sinus infection at one point in their life. It is miserable. It's usually allergic, but it can be bacterial as well. Our signs and symptoms are pain over the nasal cheek area and also the head, the forehead area, fever and nasal discharge. So what we can use is some saline to irrigate to clear the nostrils, like, they use that nasal. That's not highly recommended because people can become addicted to nasal spray. So be careful with that. But it does clear up any of the mucus and make it easier to drain out the mucus from the sinuses. Intranasal corticosteroids, decongestants, hot packs, Tylenol and ibuprofen, humidification, oral fluids, positioning, antibiotics, and surgical drainage can also. So obstructive sleep apnea is often caused from patients that are overweight. They have a high palate or a receding mandible, meaning that when they sleep and relax, their chin kind of falls into their airway. Smoking. It's basically people who snore a lot can also suffer from sleep apnea. The older we get too, the more our muscles kind of relax and can become a danger. So complications for this could be heart disease, hypertension, stroke, diabetes. One of the major signs again is snoring, daytime sleepiness, because when you can't breathe when you sleep, you have a tendency to wake up multiple times during the night. Headache, memory and attention problems, just like lack of sleep will cause. So sometimes they have to have night sleep studies done. And what you do is you go into a place and they hook you up to all these monitors and you go to sleep, and then they figure out if you have sleep apnea or not. And if you do, then they usually hook you up with a CPAP, which basically provides positive ventilation. Now, somebody told me it's not cute to have a sleep apnea machine at all. And it's not romantic either. But patients who finally get good sleep depend on it so much, they feel so much better that they just kind of do it anyway. And they're very dependent in order to get decent sleep. So we want to avoid sedatives, and we want to teach to lose weight. Nasal patches, those breathe right patches where we used to use to expand the nasal airway. Non-invasive positive pressure ventilation, which is your CPAP, and surgery can also be done. Sometimes it's to get rid of the tonsils, because the tonsils can also block the airway. As they relax, they lean back into your larynx, and they can block the airway and cause obstruction. So, infectious disorders, we got viral rhinitis, another name for a common cold. Pharyngitis, which is inflammation of the pharynx. Whenever you can't talk, you have laryngitis. That's inflammation of the mucous membranes. And of course, tonsillitis, which is infection of the tonsils. Strep throat is one of the number one causes for tonsillitis. The problem with it is basically, especially in young children, is some people are born with larger tonsils than airway. Like sometimes you look into somebody's airway, like a child's airway, and if they have tonsillitis, they are having stridor or difficulty breathing because their tonsils are blocking most of their airway. That's a medical emergency. We got to get those tonsils out of there. And sometimes you can kind of determine that a patient or a child is going to have their tonsils taken out because it's too much of a risk to their airway. Like they're too big in comparison to the rest of their airway. The flu is commonly called the flu, influenza, transmitted by coughing and sneezing. To prevent the flu, we take a yearly vaccination, hand washing, and avoiding of infected people. Signs and symptoms are fever, chills, um, body aches, sore throat, cough, sleepiness, headaches. What we're going to do is we're going to take some Tylenol. We want to avoid aspirin. Why? Especially in children, aspirin with a viral infection can cause Rye syndrome, and that is deadly to children. But it's not very effective to viral infections anyway. And we wanted to take antiviral agents like Tamiflu, get lots of rest and fluids. Other respiratory viruses are West Nile. It's transmitted by mosquitoes. The avian flu, or otherwise known as the bird flu. SARS is severe acute respiratory syndrome. And swine flu. A lot of you are old enough to remember swine flu. I don't know how they came up with this name, but it was a flu that was actually affecting younger people. It wasn't affecting the older population, because the older population, like in the 1950s, were already exposed to it. So their immune systems were able to fight swine flu before they even got any signs and symptoms. Whereas the younger generation in the early 20s and 30s were actually dying from swine flu. So they got an immunization real quick, or that could have become a pandemic as well. So a nursing diagnosis for upper respiratory infections is impaired comfort, hyperthermia, and risk for infection or transmission to others. Cancer of the larynx. The pathophysiology is primary tumor of the mucosal epithelium, metastasis to the lungs, liver, lymph nodes. Usually the etiology is associated with smoking or alcohol, and it's a lot more common in men. Signs and symptoms are hoarseness, change in voice, pain, dyspnea, cough, dysphagia, and airway obstruction. Diagnostic test would be a laryngoscopy. CT scan or MRI can also pick up. Therapeutic interventions would be radiation and chemotherapy and possibly a laryngectomy. So just have an idea that you're likely going to have the vocal cords taken out. And so they're going to be with that voice vibrator thing to help them speak. Post-op nursing diagnosis: ineffective airway clearance, acute pain, impaired verbal communication, imbalanced nutrition, impaired swallowing, grieving, and disturbed body image. Here's a device that can help aid in speech. So they can do an implant. Ultra Voice is placed inside the denture or retainer. Patient speaks into a small microphone. And then there's the Blomsinger voice prosthesis. It helps for, let me see, what's this? Helps from tracheoesophageal speech. Remember, it's this little device here that they put up against their trachea area, and that helps them talk. Sorry, review questions already. So ice packs are used for epistaxis for which reason? 1, to promote comfort. 2, to promote vasoconstriction. 3, to reduce swelling. Or 4, to reduce congestion. The answer is 2, to promote vasoconstriction. What nursing instructions should be provided following a septoplasty? That's when you have a deviated septum. Maintain semi-fowler position. Anything having to do with the lungs, we want to maintain a semi-fowler position. Plus, we want to promote drainage so that the patient doesn't aspirate. Take stool softeners. Sure, why not, right? I mean, we don't want to increase the pressure of the intracranial pressure. So that would always, remember, when you have to strain to have a bowel movement, that's going to increase and cause problems with the septum area. Use ice for swelling. That sounds right too. Blow the nose gently to remove clots. Negative, Ghost Captain. I would not have any nose blowing, I don't think. Expect a low fever for 3 days. I don't know. So let's see what the answer is. My guess is 1, 2, and 3. Yes. We don't want to blow in because you might dislodge the clot and that could be keeping them from bleeding. And I just can't figure out why the other one would even be considered. Which nursing intervention is appropriate for a sore throat? Warm, moist pack around my throat? I don't know. Hot tea, sure. Bed rest, yes. Salt water gargle, of course. I don't think a warm, moist pack is going to be, 4. Gargle with salt water. I guess that wasn't a select all that apply. Oh well. Number 4. Which patient is most at risk for complications of influenza? A 46-year-old teacher, a 19-year-old student, a 78-year-old retiree, or a 32-year-old factory worker? Most at risk for complications for influenza. I'm going to say, I think it's number 3 because elderly at risk for most everything, and that's the only elderly option. What are common risk factors for laryngeal cancer? Remember, it's male, so female is out. Smoker, sure. I'm not sure about obesity. I don't think so, but I do know that alcohol abuse. I'm going to say 2 and 4 are going to be our answers. Oh, and 5. Good to know.